This is Call the Psychiatrist, the show where psychiatrists answer your questions. I'm Dr. David Handley.
And I'm Dr. Abby Snavely.
In this episode, we have two listener questions. The first comes from a listener whose therapist died unexpectedly. And the second question comes from a listener who wants to know what her therapist is writing in his notes.
Say you like me, you better count the ways.
Are you okay? How are you feeling?
Not great, but The show must go on, right?
We are consummate professionals, if nothing else.
That's right. All right. Well, just a quick reminder, listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified health professional regarding any medical questions or conditions. So before we get into this first question, I just wanted to say how much I really appreciate everybody that messages us, sends emails, DMs, or whatever, with questions or with feedback. It's almost embarrassing to admit just how happy it makes me when I get messages.
Yeah, it means a lot. It really does.
Yeah, it's so different than the usual slog through email. I get a full dopamine hit for sure.
Well, then it's working, right? Then the pod is worth it.
Our first question, I think, really speaks to one of the reasons I was interested in even doing a podcast. And I feel privileged whenever a listener has submitted a question, and certainly with this one that we're about to discuss. All right, so here's our first question. What do you do when your therapist dies? Last week, my therapist did not show up for our regular appointment, and I was concerned. It was not like her at all. In fact, she's not been late to our sessions ever. I did not have a way to reach her other than her phone number and email address. I called, and the voicemail was full. I started getting very worried and learned from a Google search she had died in an automobile accident. The funeral is on Tuesday, according to the obituary. I am devastated. My therapist has helped me through so much. If anyone else died, she would be the person who would help me grieve. Is there a protocol to follow? I want to go to the funeral, but I know I'm not family or even a real friend, yet I want to say goodbye. There's almost no one who loomed as large in my life. Do you all understand how important you are to us? What do I do? AR.
I've read this multiple times and it's still, I get a little choked up. It's so real and heartfelt and so painful.
Yeah, the email came in on a Sunday evening, so I got it pretty late Sunday night. I was just in bed reading. Mm-hmm. And of course, I immediately thought that AR should go to the funeral if they wanted to go, and felt strongly that this person's therapist would have wanted them to do whatever they needed to do to help get through this loss.
Good point.
I even turned and asked my wife about it. I framed it as, when I die, would you have any concerns about current or previous patients coming to any service? And immediately she was like, of course not. And it led to an interesting discussion about the nature of these services is about the ability for a community to grieve, that the sense of loss is shared by so many people.
Dave, I think that's a good point to highlight the really unique nature of these therapeutic relationships. I mean, it sounds like this patient was really helped by their therapist. And to me, that automatically signals that it was a deep and real relationship. But outside of this funeral, it could be nearly impossible for the patient to do anything but grieve completely alone.
Yeah, I think that's what adds to some of the tragedy.
Yeah. If you don't know any of the other patients or anyone else, I guess you could tell your friends or your significant other, oh, my therapist died, but nobody would know that person. Nobody close to you knows that person, and definitely not in the way you do.
Right. Yeah, you miss the opportunity to eventually reminisce with people, to tell stories and to laugh, to cry together, to have that sense of shared loss. And yeah, it definitely makes it hard. Mm-hmm. Well, the next morning, I got in touch with you, Abby, to see if you had anything you wanted me to add. So normally, not to get into our production schedule, but this was time sensitive. And so I got back to AR right away and shared basically what I've shared just now, endorsing the fact that it's certainly done. I don't think it's that uncommon, I guess is what I wanted to convey. Mm-hmm. I've certainly been to funerals where former patients have attended, and I was actually quite moved by it. So I wanted to make sure that AR knew that. And then you had wanted to add one other aspect to that.
Yeah. I mean, I think that, as always, confidentiality is important. I mean, I don't know what type of community, what size or whatever that AR lives in, but if they didn't want to identify themselves as a patient at the funeral, then my piece of advice was to kind of have something ready. If someone says, "Oh, how did you know the deceased?" If that person felt fine identifying themselves as a patient, then great. But again, it's so private. I could see or I could understand being caught off guard by that question. And it's fine to say nothing, or it's fine to be vague. It's fine to tell the truth or redirect in some way. I think that's fine. But to be called to identify yourself to a stranger, I think probably would be a really unique situation. And I guess I didn't want AR to feel like they were going to be required to violate their privacy in order to grieve.
Yeah, I agree with you. I think
Mm-hmm.
whatever AR chose to say was perfectly fine. It was more
Mm-hmm.
just have a sense of what you might say so that you don't have
Right.
to add that burden through something that was already going to be really difficult.
Yeah. And really disorienting.
Yeah. So I heard back, I think later that same day.
Okay.
And so here was the message. Thank you for writing me back. I took tomorrow off from work and had planned to sit in my car outside the service. I did not want to intrude. Now, maybe I found the courage to go in. I imagine there are a few others like me. She was something special. And then I think the following day, I got this message. Dear David, I thought I'd let you and Abby know that I made it through one of the hardest days, in part to your encouragement. I went to the funeral. I was actually invited to be there. Yesterday, her husband sent an email to me and probably all her clients letting us know about her death. He said he hired a grief counselor to be at the funeral to meet and support her, quote, cherished clients. We could attend from a separate room in the church if we wanted some privacy. That thoughtfulness did not surprise me. I saw her on and off for many years, so I had a sense that she was a good person. I did not know, however, much about her life outside our sessions. She never mentioned her husband's name, and she was very private with regard to her grown daughters and grandchildren. I didn't know much. When I saw her daughters this morning, they looked so much like her. I could not stay. Even though I was invited, I wanted to respect that it was a ceremony for her family and real friends. I drove to a park next to her office instead. It was familiar to me. I will miss her. I'll also miss her office, which for me was a very safe place. It is inside a beautiful and historic building. I can even hear the old wooden staircase creak as I approach the third floor. I am devastated, as I'm sure everyone who knows her is, but our relationship feels different from friends and family. It is remarkably private. As I said, what do you do when your therapist dies? Yeah, I agree with her. I think we talked about the nature of how, as she says, remarkably private that relationship was.
Mm-hmm.
Again, that she doesn't have the opportunity to grieve with other people. I was even thinking about if they had been part of a group psychotherapy, like the group would have at least continued and mourned
Yeah.
together. And man, the other thing is this therapist's husband, and I'm sure her colleagues and her friends. I mean, what a class act to have the
Yeah.
grief counselor available to be thinking about people who may be grieving and possibly wish for privacy and have a separate part of the building to grieve
Mm-hmm.
in.
Yeah. And I think AR's point is well taken, that, and it sounds like the husband had this impression too, that the nature of the relationship is different. But I also am willing to bet that the patients know a side of the therapist, and maybe, at least a version of the therapist that the family and friends don't know. I've heard people talk about that when therapists, when they're at the top of their game, it's almost their best self, right? I mean, they can keep all of their own hangups out of it as best they can. And so the closeness is probably, it is in and of itself unique and remarkable. And so I guess I don't think that the writer is feeling that way, but I wouldn't want them to think that they were somehow like a second class citizen or they didn't belong there. I mean, it sounds like the husband and the family and the colleagues absolutely believed that the patients belonged there.
Well, as you said, it's a different relationship, but those
Right.
relationships were important to the therapist. I mean, that idea of them being their
Yes.
cherished clients, that's real. And I think that conveys the fact that they were being so thoughtful is a
Hmm.
reflection of the therapist in my mind. The fact that
Right.
they knew that it was important because, as we've said in the past, these relationships are bidirectional.
Of
I was
course.
thinking about an earlier episode. I don't remember what number it was, but we answered somebody's question about that we talk about it as if it's real and they're not. And I just think that AR has answered that question in a way better than we did or that we could.
For sure.
I was wondering, this is a different scenario, but maybe
Sure.
some of the same things could come up. But have you been to a patient's funeral? Because I have not. And I think I would struggle. I would want to go, but I would also struggle because I wouldn't want my presence to divulge confidentiality. But have you had an experience like that?
Yeah, I've had a couple experiences of patients dying while they were in treatment with me or shortly thereafter. The first person that comes to mind is someone who had a chronic and severe mental illness and, for a variety of reasons, had a pretty small life, but had a real connection to me, to some other doctors at the clinic that I was working at the time. And we were explicitly invited to the funeral. And it was a big honor. But even though we were invited, I definitely left as soon as the service was over, maybe to avoid some of those conversations or wanting to respect that person's privacy, even in death, which we're obliged to do, but I also just personally think is important. And in that same vein, another person I'm thinking of, she and I were very close and she passed away. I was very sad, not invited to the funeral, and was probably, if I'm being honest, a little bit disappointed because, again, that opportunity to say goodbye and to grieve and to be with other people who knew her might have been helpful to me, but I wasn't going to go. I wasn't going to go and identify herself, but in a real, like you said, class act. And I think ultimately loving gesture, her husband sent me a letter thanking me for the work that she and I had done together and letting me know that I was important. And so I think that was a nice piece of closure, though, again, not the same as being able to hear other people reflect on that person's death. Even though I think you're right. I don't think, as in our position, that we could ever be a full participant in that, even if the ritual would be helpful.
Yeah. Let's see. The AR asks if we know how important we are, and it's hard to talk about without sounding arrogant. So I think what
Right.
I can say is that in my training, there were times that I did not understand how important the relationships were. And I think some of the biggest mistakes that I made when I was young were really around some of the endings of treatment. I think when you're learning, we tend to discount ourselves. And I would often, I think, be focused on what wasn't accomplished. And so then I would end up caught off guard about the magnitude of the loss that the patient was
Yeah.
experiencing. And so that was something that I learned for sure.
I also wonder if some of it's protective, right? I mean, I think especially in training, there are these forced endings or forced terminations because you are graduating. And I guess I wonder if fully realizing the pain you are causing people would be painful. Unconsciously, of course, but that's a pretty tough pill to swallow.
Yeah. I wondered maybe a different way of even getting to that question
Mhm.
would be just flipping it around a little bit. Because, Abby, I feel like you've talked a lot about the importance your therapist has been to you on several different episodes. I think you could speak to that about answering, do you know how important you are? Well, probably.
Uh, well, but I think you're right. I think I can only hope to be as important to other people, but to have experienced, yeah, you're right, the other side of that relationship and how deep and meaningful it is. And that, yeah, that especially to me, he was, he was my long-term therapist. I mean, I still see him occasionally, but I dread his death, even though if the order of the universe is correct, he'll die before me. Not even because I see him very often. It just will be tremendously sad. I mean, to have a real and final loss of one of the most important relationships of my life.
Well, I think that answers the question for sure.
Yeah.
I have a couple of points that I do want to make because I'm aware that
Sure.
some therapists do listen to our show. And really any doctor or therapist in private practice, it's best practice to have some type of proxy decision maker in the event that, you die before you retire. I have to think that AR's
Mhm.
therapist had something like that in place, or certainly had colleagues and friends that were able to take care of her patients after her death. And so I just wanted to maybe remind folks of that if that's not something that they have in place, something to think about for sure.
Yeah.
And then a final thought I had, and this isn't advice necessarily to AR, but this is a topic that comes up quite a bit, and it is about if there comes a time that a person wants to meet with a new therapist, because I know there's always a lot of resistance around that, especially when you've had a deep and meaningful relationship. But the thing I always tell people is that it's going to be something completely familiar and completely different when you experience it again, because ultimately the narrative you have about yourself has now changed. People often say, I don't want to start over. And I say, I think with sincerity, you're not really starting over. You're starting from a new place because you've actually changed quite a bit. And that new
Right.
place is largely because of the work that you've already done. And in some ways, you can honor that work as if you decide that you want to start again.
Yeah, I think that's well said. And in this vein of acknowledging the real relationship between the two people, you will get something different from a different therapist. That's not better or worse, just different.
Well, words are often not adequate in these situations, but we're certainly sorry that AR is going through this. I hope that
Mhm.
maybe sharing this story in some way honors this therapist.
I think it is a nice way for the therapist to be honored. And you're right that words often fail us, but this was an important thing to reflect on. It's moving. I wish you didn't have to go through this, but I really feel pretty honored to have you share that with us.
All right. Well, we're going to take a quick break and we'll be getting to a question about what are we writing in our notes.
Dancing just you and me.
This next question comes from Rose.
Great show. I'm learning so much from you both. Thank you. I'm curious about the notes my therapist takes. What's that all about? Can I ask to read them, or would it be humiliating? I watch him scribble furiously from time to time, and it makes me wonder what I said that was so important. Other times, I think what I said actually was especially important, and there's no notes at all. I'm a few sessions into therapy, and I don't know the rules. There are so many things that feel shrouded in a kind of mystery. I wish there was a guidebook. I hear your message loud and clear about talking to my therapist, but what if I don't know what questions to ask? Any suggestions for how to proceed would be much appreciated.
Yeah, I think everybody at some point or another has felt the way Rose feels about the notes. I've seen a lot of good memes saying that same thing. Also, Abby, you know that I'm a huge Irving Yalom fan, and he
Yeah,
apparently gets asked all the time what his patients think about being included in his books, and he gets their permission, of course. But he said that the
sure.
problem is no longer about that they're going to be in a book, but to the idea that they may not be able to get into his book. So they worry that they're not being interesting enough to get included. My
Right.
point being that we all want to be interesting, especially to our therapist.
I mean, people all the time are saying, "Oh, I'll make a great paper. Or you could do a case study about my family." And usually they're not wrong. I just am not in the business of writing books or,
Right,
articles. so
right.
so they're out of luck.
One other Yalom point I was going to make, and it's pertinent to the note idea, is he's got that book Every Day Gets a Little Closer, where
Uh-huh.
he and one of his patients actually write the book together. So it's he writes his note about how he perceived the session, and then the patient is keeping a journal about her
Mhm.
perception. So I don't know if that would be interest to anybody. People either
I
tend to
think
love
it's
it
a
or hate
very
it, but
interesting book. Yeah.
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 And then I love Rose's idea about a guidebook to therapy. I'm actually surprised that doesn't exist already.
So maybe we should be in the business of writing a book.
Yeah, no, right. I do wish I wrote more.
My God. Right. Sure.
But yeah.
Hmm. Hmm.
Yeah, no, I think that actually would be a great book to write. And maybe Rose could be a collaborator because everything's fresh for her right now. All right. So I thought this question was only going to be fun, but I realized with a little more reflection that there was actually an important idea in here that comes up for people who are reluctant to go into treatment. There are a lot of times people are not getting help because they don't know what's going to be written down and then disclosed in the future. And so people worry about if they're a profession that requires licensing, if it's
Mm-hmm.
about getting life insurance, disability insurance. There's a real fear out there. And so I realized that this actually could be helpful to folks and maybe a little comforting to find out how we think about this, what gets documented, where it gets documented, and that sort of thing.
Yeah, I don't think that those fears are necessarily unfounded, right? I mean, especially in the United States, health insurance could be withheld or premiums could go up. I think people sometimes fear that if they're going through divorce, that the notes could be subpoenaed to make them sound crazy or something like that. The bad uses of a certain kind of note, I think our imaginations could run wild, but you're right. I mean, number one, we will reveal that psychiatrists can suck the fun out of anything, as you already pointed out. Number
you.
one, and I mean, you're just good at your job. And then number two, it's just much more banal than you might think it is. But anyway.
Yeah. And also, the fear is founded in terms of health insurance companies for sure.
Sure.
In terms of losing some of your privacy. But that's why I think the conversation is always worth having with patients. Like
Absolutely.
if anybody has concern about what I might be writing down in their medical record, and we'll get to some distinctions here in a bit, but yeah, I want them to see it. I want us to have a conversation about this is exactly what I have to write, and this is all this other stuff. And like I said, we'll have some examples here in a bit to give you a better idea. So speaking of sucking out all the fun,
you have a history lesson?
Well, a little. I just want to talk about the Health Insurance Portability and Accountability Act of 1996. I mean, that's fun.
It's fun. It's fun.
This is important, so just bear with me for a second. For those outside of the United States, the main aim of this law was to make sure that if you were transitioning jobs, that you could still get group coverage health insurance. It's supposed to help increase efficiency with health plans, but that's another topic. And then the rule that I want to bring up, though, has to do with privacy. They made a very distinct separation between psychotherapy notes and the medical record. And so before then, if you were dealing with an insurance company, the entire record had to be sent to the insurance company, especially if, say, they were denying additional coverage, they wanted you to justify, they wanted the therapist or the psychiatrist or whomever to justify that this additional treatment was needed. And so all of that information would get transmitted. And so now here was a law saying that these records could be treated differently. These records had special protection in that they wouldn't be released without an additional signed consent. And while the medical record is yours, the psychotherapy notes are your therapist, and they may or may not choose to let you see them. But basically, they're protected in such a way that my understanding is that really only a judge's subpoena can compel somebody to disclose them.
Yeah, I think you're right.
So in reality, I think therapists have always tended to keep their personal therapy notes separate from a medical record, but at least this can provide some reassurance. So let's talk about the medical record note or a progress note and how that might compare to a psychotherapy note. So the medical note's the boring one. So if you have a diagnosis, it would be there. A consideration of a medical problem would be there. Labs, medications, allergies. In psychiatry, there needs to be a mental status exam and some assessment of safety. But for example, in terms of therapy, I might hear an hour of somebody telling me all the bad things that their husband is doing. Every episode of infidelity, excessive gambling, a planned separation. But my progress note that goes into the medical record would summarize all of that with discussed conflict with spouse. There's no juicy details. If I need any reminders of some of those things, then that would go into my therapy note. But as far as the medical record, that's pretty much the extent.
It is as dry and factual as possible, right? I mean, and you could say, yes, conflict with spouse, or even symptom-wise, I might say paranoia worsening, but I'm not going to say this week the patient believes that a chip has been implanted in his brain and Barack Obama is communing with him, blah, blah. Like you don't have to prove it. Like you kind of get to categorize and name if you need to justify a diagnosis or whatever else, right? I mean, it's very much a summary.
Yeah, and some of the things are in there, unfortunately, just from a billing perspective. So, for example,
especially if you're dealing with insurance.
Yeah, that's what I mean. Is it's I think for the doctors that have to do this kind of care, in the setting of a health plan. I was thinking you could spend 3 hours with someone and you wouldn't get reimbursed at the highest rate unless you commented on their gait, right? Or their ability to move their extremities. I mean, that's how ridiculous it is. But anyway, that's the medical record. And so there's a distinction then between content of a session versus the process. And so the medical record might have some content, discussed conflict with spouse.
Mm-hmm.
The content is what happens. It's all the juicy details. And the process is more about how something was experienced or the internal experience of someone while something was happening. And when I think of the process too in therapy, I also lump in that relationship between the therapist and the patient. And so therapy notes don't really have a whole lot of content, like the juicy details. I mean, sometimes a little bit of that's in there. They tend to be more
but if they're
about the
juicy
process.
enough, I'm going to remember them.
Yeah, right.
I mean,
You don't
I
need
know,
to
I
write
don't,
that stuff down. Right.
I mean, I remember people. I don't need that for myself. And to your point, if I'm writing down process notes about my internal process, that really has no place in somebody else's medical record.
Right.
I mean, the description of my countertransference is about me.
Right. I mean, the process notes could have some things though about, how's the patient navigating something? What patterns
Sure.
are becoming apparent? How are those patterns likely going to play out? How are they playing out with me? Are they progressing? If not, what are the barriers that I think might be going on? So all of that is more likely to be in the psychotherapy note, the part that's not part of your record.
Yeah, I mean, I think that maybe a way to make the distinction is who are these notes for? So if the progress note is for medical or insurance purposes, and it does matter who sees that, as we're saying, the process notes are for the therapist. The form that this takes could be really scattered, right? These notes might not be legible. They might have drawings. They might be in a circle. They might. I mean, there are so many ways, and I almost think of it as my intellectual property, right? I mean, nobody's going to buy this, but this is some. It is worthless intellectual property, but nonetheless, it is mine because it is some representation that's also, as the writer points out, not very complete, but it's a representation of how my mind is working in that session.
Yeah, and I want to make a distinction because you're talking about the actual notes being written in the session, the little scribbling going on.
Oh, yes.
Yeah, but there's also a good note, maybe a psychotherapy note that gets made based on all those scribblings. So, so I may every few sessions I'll often summarize my week to week notes into something useful. But again, I'm the only audience for it. It's for my future self to read. Like I don't do this anymore, but I think I used to try to impress my future self. I'd read something a year later and think like, wow, that doctor really knows what he's talking about.
How impressive.
Here's some specific examples. After we got this question, I paid some real close attention to what I was actually writing. So if Rose wants to know what's going on in the session, this is the most pedestrian example that I have, but honestly, it's one of the most common things I write down. It's just the names. Sometimes when I'm meeting somebody for the first several sessions, there's so many characters to keep up with and sub-characters, and I'm terrible with names as it is. And I don't actually care about the name. It's just, but I need to be able to refer to the person if I need to, for the patient to know, what relationship are we talking about? So that is how boring it is. The other thing,
I have a genogram in the front of every person's chart.
Oh, do you still
take
a little
paper? Family?
Do you still have paper charts?
I do. I still do paper charts. Because I don't want anybody getting anything. If any of these entities or companies are asking for something specific, I write a letter.
I do too, but I still use an electronic health record, and the one I use now actually has a separate field for the psychotherapy note, so it's not released.
Nice.
I still don't feel great about it. There's something weird about knowing that it exists with a corporation in the cloud,
right?
So I don't like it.
Yeah, so I still do that. Once a patient brought me at an initial intake appointment, brought me their family tree and main characters with photos and names and called it the org chart of her life.
I like it.
It was incredibly
Yeah.
helpful. I mean, if
Yeah.
this became I'm putting that in the therapy handbook.
Oh,
Like
yeah.
that, right?
I'm
I
not sure
mean,
about
these
the
are
photos
like,
though. I think that would
I
bias
mean,
you in some
that might
ways. I
be,
don't know.
it
Because you're
might.
not going to pick like the most flattering photo of the person that causes you the most trouble.
That's fair. But the pre-made org chart was golden, and there were
Yeah.
yes. Mhm.
So but that's just one of those tips of how to be the best patients. That's
That's
going to
right.
have
I
to
was going to
be
say it's like
analyzed.
we're going to have to say here are the ways to be a good enough patient, and then we'll have an extra credit section.
The other thing I write down are direct quotations from patients, and part of that is because patients will tell you what's wrong with them. And I like
Yes.
having their words to use when describing it. And sometimes I don't even use it in the same session, but I'll have it so that in the future when I want to refer back, I like being able to know exactly how they've thought about it before, whether they even know the importance or whatever that they've said. I like that quite a bit.
And I write down quotations for maybe a slightly different reason. I mean, for what you said, but you're right. Sometimes the patient doesn't know the valence or the importance. Sometimes I don't know at the time. But I also think that sometimes these direct quotes are kind of, I mean, they're almost like, I don't know, a symbol or like what do I want to say, like a metaphor or something. Like it encapsulates more than a description of it. I mean, I know earlier I was talking about categorizing symptoms or different things, but sometimes it's like just such a perfect quote that it encapsulates a lot of different symptoms and mindsets and things about how the person's mind works without so many sentences of exposition or description. It's like, oh, that's just who that person is, or that's how they think of their problem. Like, here it is. I have nothing to add.
Yeah. And I think I'm tracking along the same way in that oftentimes the patient and I will then use it as a shorthand.
Oh, yeah.
As a
That's the
marker,
best.
yeah. And so months, years later, it's, oh, right, this is, you're doing this. And then it's air quotations. You're right. It encapsulates it in a way that all the technical and the jargon and all that all that, it becomes so unnecessary.
Because the jargon is usually reductionistic, which maybe is helpful, but it's not very specific or unique to that person.
Yeah. And then the other thing I write down are just themes that I want to get back to. So oftentimes I don't want to interrupt content, some narrative somebody's saying, but there may be some ideas that I want to revisit. Or sometimes, someone will say 4 or 5 things that I think are really important. And I know that we may not be able to get back to them all. And so I'm just writing down a couple of those ideas so that hopefully we can revisit them. And I think you already said this, but if anybody wanted those, my day-to-day notes, they couldn't read them. I don't think anybody can read my handwriting. They're not linear. They're often sort of this topographical map of my mind. I don't really know. I haven't analyzed them that well, but yeah, they're a mess basically.
But they're your mess.
Yeah, they're mine. They're mine. Yeah. But what do you think though, if somebody wants to see them? Well, here's my answer to that actually.
Yeah.
There's nothing that I write in a therapy note that I haven't told the patient or that I won't eventually tell the patient. If I withhold something, it's only because I think the timing is wrong, that it might just be too early or that it just won't be helpful. I don't think it'll be harmful necessarily, but I don't think it would be very helpful. And so, as I said, if what I'm thinking is correct, it'll eventually come out.
Maybe this is the analyst-y part of me, but I do wonder if someone says, what are you writing? Or show me your notes. I agree with everything you said, but I do wonder about immediately producing the notes or doing that if that forecloses some kind of exploration, right? Like, is there something that they're afraid that I've written? What do they suspect? I mean, what do they think is happening? I mean, a couple times, maybe especially on Zoom, people have said, what are you doing or what are you writing? And then I'll just hold my pad up to the camera and it's certainly illegible, but just kind of reassuring, like, no, I'm writing down notes. Here are the notes. But, I guess I wonder about the fantasy or the imagining or the fear or whatever behind that question. Are they afraid that we're writing down something really derogatory or damning? If it's about who might see them, that's a different question. But that's also not about that. I guess what are you going to do with those notes is different than what are you writing?
Yeah. And I guess you're right too. As you said, your notes are a reflection of your own mind, and that would probably be scary for most of your patients to see.
I mean, maybe just even the disorganization of it, right? Or the number of question marks or whatever. I mean, and I guess to Rose's question, what does it mean to be writing? And then also, what does it mean to not be writing? I often will deliberately put my pen down if someone is telling me something very, very sensitive information as a reassurance, if I think they need that explicitly or not, to sort of say, like, this isn't going anywhere. I'm going to put my pen down. I'm going to look at you. This is absolutely confidential. No one will be able to discover this. So sometimes maybe the most important things I don't write down.
Yeah.
Because again, I'm not going to forget it.
Yeah, I do the same thing. And maybe just to reiterate that one more time, we don't write the juicy stuff down. Like, you don't need to.
No.
I just want to highlight that. Like, we're not writing who's sleeping with whom. It's the name. That's all I need. And in the note, I actually just use initials. Hopefully, although I'm really bad at names, so I do sometimes have to keep up with those somewhere.
Yeah, I've slipped on names before. And as much as I think that my memory is good, it can be, sometimes they're just in the same category of name, I don't know.
Yeah, I still have a really good memory for the narrative.
Yes,
I've always struggled
absolutely.
with the name part. Yeah, the name is just not important to me, and so I have to try to make it so. And the other thing, everybody writes a different amount. I mean, after I've met somebody 3 or 4 times, I don't really write that much. There's not a lot of need to, because as long as you've got a little time to write one of those summary paragraphs later on, just to organize your thoughts a little better.
Yeah, I take tons of notes at the beginning and then less as time goes on. I think that that's right.
So Rosa's final questions, what questions to actually ask. And I guess what I thought of was, depending on how active her therapist is, meaning how much are they giving in a session, or do they talk a lot? Do they confront things? Do they offer a lot of interpretations? If they don't, then I kind of think that's a good place to start with questions. If you have those questions, if you want to know what the therapist thinks is going on, I think that's a great place to start. Asking, what do they think the two of you are working on, or how things are progressing? And of course, you actually can ask what he's writing or what he's thinking about. It would actually not be a bad way to be part of the relationship.
And to pay attention. I think that there are people, I don't know if Rose is hyper attuned because it's at the beginning, but I've had people very in tune with if I'm writing or not writing, or kind of half jokingly say, like, did you get that? You should write that down. Like, that's really important. And it's like, okay, I got it. But if the overarching question is, what does my therapist think? If you have a relatively active therapist, you probably know. I mean, that doesn't mean it can't be talked about. But if someone is more withholding and that is the question, then maybe the more likely answer is that you need more from them. You need to know more about their process, including their thought process and what they think of you. And maybe you're afraid of being forgotten. And hopefully over time, the therapist proves that their memory for you is good or good enough.
Oh, that's an interesting point. I get that comment a lot. People are always surprised at how much I remember. And maybe I hadn't thought about that. Maybe that's why they're okay with the fact I don't write much.
Right. That they're not afraid. Though I remember a time of misnaming someone's spouse, even though I really think upon a lot of reflection, I knew so much about the narrative and so much about the story, but made a slip basically of 2 names in my mind that were equivalent or very similar. And it was really hurtful to them.
Oh, wow. Yeah, I think I get a lot more grace about it. Probably because I can't remember my patient's name for the first month. So.
I mean, in general, I might get grace, but I'm thinking of a particular time that it was really, really hurtful, and we came back from it. But I got kind of dragged into this thing that was my own overcompensation or guilt of like really proving how much I remembered, which I don't know if that exactly repaired the hurt, but at least they definitely knew that I hadn't forgot them.
Yeah. Oh, that's interesting.
Like, well,
yeah.
That's the name of my, your wife's name is the name of my cousin. And the name I said is the name of that cousin's sister. Right. I mean, like they're really related in my mind, I swear.
Yeah.
And it's like, what does your cousin have to do with my wife? And it's like,
But
I'm so sorry.
But I see what you mean about proving yourself, because I could say,
Yeah.
oh, no, the guy that you met in 78 at that bar with the purple neon sign when you were sitting in the booth. And I mean, I can give you everything that you've told me, but I will not give you his name.
That's right. Well, and that, I mean, yeah, and that is a trick I'm more likely to pull out at a party or something, which goes back to us being the awkward ones.
Yeah, oh yeah. No, I do that all the time too.
We've never met before. And I'm like, no, we actually met
it was a
2012.
Thursday. It was cloudy. Yeah.
Mm-hmm. You were
I
wearing a pink shirt. This is what I was wearing. This is who else was there. This is what we had for dinner. And they're like, really? I've never met you. It's like,
that's funny. I do that all the time. And I guess I get a little more.
I can't stop myself.
Well, sometimes I guess I'm doing it intentionally, because if it's the third time we've met and you still don't recall, I'm going to make you relive all three of them.
It's a little sadistic.
In that level of, yes, exactly. Yeah. Like I get a little, my ire gets up just a little bit.
You're right. Sometimes, and you're right. If it's the first time, I might be like, I'm pretty sure. Like, I think I'm a little more self-aware, but yeah, if I get dragged into it. But that's not about my memory. That's just about feeling unmemorable.
Hey, do you have anything else, or I can, before I sum this up?
Rose asked, would it be humiliating? I don't think so. I mean, this is a normal curiosity. If your therapist can't handle this, I mean, you're early, but probably they should be able to work with you around it. And no, I don't think there's anything to be embarrassed about or worry about either yourself or your therapist. So yes, talk about it, but hopefully we've given a lot of possibilities and examples of, I mean, I guess the reason not to ask about it is you might just be disappointed. I don't know.
I think you're right.
Yeah.
And then back to my serious point, though, for people who are reluctant, I hope this has maybe been comforting. And again, I'll just to say one more time, if you're worried about what's going in your medical record, then talk to your doctor about it.
Yeah.
I'm never going to put a diagnosis down that we haven't talked about.
And even if I get a request from a life insurance company or something, I always show the patient what I'm going to send in or what I might send in. I always get their approval.
Oh yeah. I always run any correspondence, I run it past the patient first.
Yes.
And like, I think you said this earlier, I don't just release the records anyway. I tend to write a summary. And I've never had that not be okay, except for, one person I think wanted the specific progress notes. I was like, okay, I mean, that's not a problem. All right. Well, thank you to AR and to Rose for taking the time to send in their questions. And we thank all of you for listening. Please send in your questions by email or an audio message at our website, callthepsychiatrist.com. We'd love to see you on Instagram and Facebook at Call the Psychiatrist. And if you've gotten any benefit from the show, we'd really appreciate it if you'd write a review wherever you listen to the show. Take care.
Bye. I don't want any representations that make me seem neurotic, because I'm absolutely not.